mode.
Welcome to our open house online. I'm Nancy Schartz-Hopko. I'm the director of the PhD program in the College of Nursing at Villanova University. And with me tonight is Stephanie Jeffers, a 2011 PhD graduate.
Thank you for having me, Nancy.
It's great to have you here. Villanova University is a Catholic university that was founded by the Order of St. Augustine, a men's religious order, in 1842. The College of Nursing was established in 1953, and just in 2008 we moved into our beautiful new home, Driscoll Hall. Just as an aside, the ground floor is entirely sim labs, and it's very state-of-the-art as well as quite beautiful. The aims and purposes of the PhD program are for the preparation of nurse educators who are well prepared in curriculum development, student assessment, teaching and learning, and who also are prepared to conduct research that will, if they assume a tenure-track position upon graduation, will enable them to achieve their goal of earning tenure in an academic setting. The PhD program was inaugurated in 2004 with an initial class of 12, and just as of a couple of weeks ago, we've had 46 people successfully complete the PhD. Our first graduate was in 2008, so we've done really well at moving people through. We actually have an average completion time of 5 years. Who should apply for this program? Well, we're particularly interested in people who are interested in careers as academic nurse educators. So the emphasis of the program is on teaching and learning. Of our 46 graduates, most are in academic settings full-time. We do have a couple of clinical educators, and we have a chief nurse of a pediatric hospital. We have a chief nurse of the Ministry of Health in her country, and another person who's a high-ranking ministry official. We have somebody who's involved in accreditation for one of our nursing specialty organizations. But the vast majority of them are in academic positions, and a number of them have already moved into academic administrative roles. We have a dean at the University of Guam. Stephanie, what was the appeal of this program for you?
Well, there were several advantages to this program, and the first being that it was one of the few schools in the area that offered a PhD with education credits, and I was looking to work full-time in an academic setting, so that was one of the reasons why I wanted to pursue this particular degree. Secondly, I really liked the idea that the program was online but in a synchronous format, so that I could interact with other classmates as well as the faculty in an online format, and it would be flexible for my schedule. And also, having received my master's from Villanova with my master's in nursing education, I knew that the faculty were excellent, they were very supportive, and I knew that I would get a good education.
Great. So what are you doing now, and how has this program helped you move your career in the direction that you wanted to?
Right now I'm in a tenure track at a local university. I'm in my 3rd year. I have been able to move into this position from a staff nurse position pretty easily. The program here at Villanova prepared me with the academic skills to lead a classroom as large as 70 to 80 students that I currently have, as well as take on the role of a researcher and a scholar. So I did complete several research studies. I've done several presentations and have had several publications as well.
That's terrific. Thank you. One of the things that people ask about is what degree they need to have in hand to enter the program. Most of our students, actually all of our students to date, have had a master's in nursing upon starting the PhD program. And the reason that that tends to be the general trend is the state of Pennsylvania, until very recently, specifically required that no matter what doctoral degree you had to have a master's in nursing in order to teach nursing. And there are still other states out there that do have that requirement. We will allow a BSN person to enter the PhD program. We have a mechanism where they will take more than the usual amount of credits so that they complete MSN requirements on the way to the PhD, so that they aren't, employed in one of these states where the MSN is required and sort of caught up short. If they were to go through from bachelor's to PhD, the credit savings would be 18 credits. I'll comment on the types of dissertations that have been completed so far. We emphasize, because we're preparing nurse educators, we talk a great deal about teaching and learning. And I tell students, your research should have something to do with teaching and learning, but it could be a clinically situated study, teaching patients to manage something, teaching people how to avoid an illness or a complication, teaching other staff how to provide better quality, safer care, or enhance access to services. On the other hand, people may want to do a traditional nursing education study, and while there's not a great deal of funding for that, we will certainly support those kinds of studies. Stephanie, what was your dissertation about?
My dissertation was titled Nurse Faculty Perceptions of End-of-Life Education in the Clinical Setting. It was a qualitative study, and I interviewed nursing faculty about their experiences teaching end-of-life care to nursing students in a clinical setting. And it was very interesting to go through this research because I found out a lot from the faculty about their personal experiences, their professional experiences with patients, and how that affects how they taught death and dying to their students, and they felt that it was very important.
Thank you. The program is delivered 80% online, as Stephanie mentioned, in synchronous web seminars. In the fall and in the spring, the web seminars are scheduled on Tuesday and Wednesday evenings, always between 4 and 9:30 p.m. Eastern USA time. We've maintained that schedule since 2004 so that people can plan well in advance with their work and so forth. The students come for 3 summer intensives, 3 different summers. They come to be on campus for 2 or 3 weeks. We always start the day after Memorial Day. People are often concerned about the distance delivery. What was that like for you, Stephanie?
The online format, I thought was great. I mean, it fit in perfectly for my schedule because at the time I was working as a staff nurse part-time, I was working part-time as a clinical instructor, and I had 2 children who were 7 and 4 at the time. So it was better for me to sort of attend class from home. So I mean, I was online with my students, but I could still ask questions and interact with people. I could see them on the screen. So it was a continuous dialogue that was kind of like in real time. And it was flexible for me because if the earlier classes, say at 4:30, my husband might not have been home from work yet, but I could still sort of be in class and kind of keep my eye on my kids at the same time. And then the later classes were fine. I would just kind of retreat to my bedroom and go to class. But it was great because it was a time saver. I didn't have to go to campus to do anything, and I could still have the benefit of speaking with people and interacting.
That's great. The summer intensives that I mentioned in the first summer include orientation to the program and the technology, as well as 1 3-credit course. That's 2 weeks long. The second summer, it lasts 3 weeks, and it includes 2 3-credit courses. And then the third summer, it lasts 2 weeks, and it includes, for most students, the qualifying examination and their a 3-credit course. For some students who are full-time students, that might be their last course that they take. We have housing available on campus, apartment-style dorm living, so there are 4 people sharing a little apartment that has a little kitchenette and living room. And around the campus, there are numerous eating opportunities on campus as well as off campus. Usually in every cohort, enough people have cars that getting around is not a problem. As people think about applying to this program, you might want to take a look at the technology requirements, and those are posted on the program website. We used to require that everybody have the same hardware, but now we are a bring-your-own-device university, And so we specify the capacity that your device needs to have. And we have not had significant problems with connectivity. That was always early on one of my big worries. I had a person who finished the program who lives on Guam, which is a tiny little island in the middle of the Pacific, and that woman had the best connectivity we've ever had of anybody because they're so dependent upon it. I want to mention a bit the focus of the coursework that students take. As I mentioned, we're preparing educators who are skilled in research. So students take 6 credits that I call general education. That includes a social ethics course and a health policy oriented course, which is the first course in the program. They have 18 credits in preparation for the role of academic educator, and they have the remainder of 51 credits focused on developing as a researcher. I will say 2 things. One is that if you come into the program with a master's in nursing education from Villanova, you've already completed 15 of those 18 credits. And if you have a master's in education from another program, we will evaluate your education courses to see what could be transferred. The policy is to be able to transfer 6 credits. There are sometimes exceptions to that. Another feature about the program that students seem to like and it seems to be effective is that you start dissertation seminar quite early in the first fall that you're enrolled. Stephanie, what was that like for you starting dissertation 1 so early?
I think it was very important to start early because you have a broad sort of topic of what you want to do, but you're not really sure which direction to go, how to narrow it down. So with the help of your cohort and the faculty, you can have this discussion and throw ideas back and forth early, and then from then on, every course that you take, you can write a paper or do some kind of assignment that is related to your topic so that by the time you get to your comprehensive exam, you're sort of ready to go and move forward with your dissertation. Not all schools in the area offer dissertation seminars that early, so I think this is a great advantage of this program.
Thank you. We do know that in some programs people finish all their coursework and then they're in somewhat of a panic about having to think up a topic for their research. I wanted to also ask you, you commented on the advantages of distance learning. What kind of support did you need technology-wise from the university, and how did that work for you in terms of robustness of the connections and access?
The connection, the actual internet connections, I didn't have any issues with as far as being in class and not being able to access class. So we didn't have any issues with that. As far as online learning and connecting with faculty and students, it was just the same as being in class. They were always available. You could actually speak with them, and then if you needed further assistance, you could call them or email. So they were always available and very supportive.
Good. Okay. I want to note for people that might be interested that we certainly do have an option for people to attend class with faculty on campus. It's required for at least 2/3 of the credits each semester for our international students. It's a visa requirement now. But some of our local students have preferred to come to class at least part of the time, and that's certainly something that we enjoy people doing. We have a few students who will be on fellowships, who already are and who in the future who will be, and we expect our fellowship students also to try most of the time to be present on campus for classes. So as we noted, the dissertation work begins early, and many of the assignments in all of the courses through the curriculum, or many of the courses, many assignments can help students develop their proposal ideas. One of the questions that people ask all the time is, oh my gosh, if I wrote about my proposal in this course, am I allowed to write about it again in the next course, because that might be self-plagiarism. Well, that's exactly what we want you to do all the way through the program, is keep working on your topic, keep getting feedback from lots of different faculty, and keep developing your ideas. So that's a good thing, not a problem. Maybe if you were bachelor's students, we would call that a problem. But here, it's excellent. Each of you if accepted into the program, will be assigned an academic advisor, but as you move through the coursework, you'll start to think about who is the person that you would like to work with as the chair of your dissertation committee. And then once you identify that person and they agree to work with you, the two of you will figure out who's going to be the second person that would be well suited to round out the committee, either in terms of content or methodology. So Stephanie, what kinds of things helped you move through the process of developing and then completing your dissertation?
First and foremost, I have to say that if you're going to be starting the PhD program, you have to be very organized and be able to manage your time efficiently. Especially for me, I was working like 2 different part-time jobs. I had children that were young. So I really had to plot out certain times of the day where I was going to be reading or writing. And there is going to be a lot of reading and writing. So I think first you have to be organized and efficient with your time. Secondly, it's important to rely on your cohort for support. So my cohort actually got along very well. We gelled very early, and we often supported each other. So if I had questions about course content or my dissertation topic, or do you think I'm headed in the right direction, I could call on them. We could talk via Skype or other methods. So that helped as well. And the dissertation seminars and every course assignment, as you mentioned, Nancy, that you're writing a paper for, you have a broad topic to start. Usually most people don't have a very specific question. But my broad topic was end-of-life education, so I could talk about that in many different ways and then figure out exactly how I wanted to study that.
Mm-hmm. Okay. How was it managing work while you did all this, along with your kids and stuff?
Looking back, I don't know how I did it, but during work, so if I had downtime or if I was at lunch, I would bring all of my articles with me and read while I was at lunch. If my kids were outside playing in the front yard, I could sit outside and read for class while they were playing. So every opportunity I had, I was reading. So I just happened to fit it in and make it work.
Wow, that's great. How did you and your cohort interact other than in your on-class webinars?
Several of the people in my cohort were local, so we were able to get together outside of class in person. And then one of my cohort's members was in Connecticut, and we often would talk in internet chat rooms or via Skype. Another person was in California, and we did the same with her. And then often when we were presenting posters or anything for conferences, we would meet up with them at the conferences as well. So we saw each other than the summer session or online in the virtual environment.
Mm-hmm. Okay. So how did you decide who was going to be your chair, and then how did you work with that person?
I chose my chair based on her expertise in end-of-life grief and loss, and I knew that she was the best person to go to for that. I also had her for a death and dying course in my master's program, so I knew that she would be the content expert for my dissertation. And then from there, I wasn't sure who to go to for a second person. So I asked her for advice. I'm like, who do you think would be a best fit? Who do you work well with? And she made a recommendation, and it worked out good that way.
Oh, good, good. So as we said, we have a 2-person committee, a chair and then another member, and they complement each other in terms of content expertise and methods expertise. In addition, for 2 defenses, there will be readers, 2 readers who also provide additional sets of eyes. At the proposal defense, the student has prepared the research proposal, and the 2 readers are trying to give suggestions to make that the best study that it can possibly be. And then at the end, we try to bring back the same readers because they want to know how it all turned out. And their suggestions are having to do more with, best presentation possible, editing or rearranging content. So we look at these as developmental milestones more than barriers to completion of the program. I want to talk for a minute about application requirements. Application to the program is competitive. Every year we have between 3 and 5 times as many applicants as we can admit to the program. And so it is competitive, and I urge everybody to consider other places to apply to that will get you to your career goals. The process of application entails filling out the application form, paying a fee, which is waived for live participants in our webinar, but not archived participants, submission of your nursing license, GRE scores, higher education transcripts, your CV, an essay that we prescribe, a sample of writing, 3 professional references, and an interview with me, the program director. Also, we require, at least before you matriculate, but you can do it at the time of application, a criminal background check. International students are required to complete TOEFL exam. Every year, the deadline for admission is December 1, and admission then happens the day after Memorial Day. So for the coming year, for every year, December 1 is the deadline, and then the program will begin with the first summer session the day after Memorial Day. You can stay in the applicant pool for 2 years without reapplying or without repaying the application fee. And as I mentioned, the policy for transfer credits is 6 credits. We mentioned the milestones of proposal defense and final defense of the dissertation. The other major milestone besides completing coursework is there's a qualifying exam that usually students take during the 3rd summer session. The students will get the topics of the qualifying exam around Christmas time, and then they organize themselves into study teams to tackle gathering the material to help them be able to answer 2 questions on the day of the exam, 1 in the morning, 1 in the afternoon. So you get the topic, you don't exactly get the question, and it's a test of your ability to synthesize on your feet. We have several funding opportunities that we can offer students. Most students, since the program began, have been well served by the Federal Nurse Faculty Loan Program. That is a non-means tested program that allows students to borrow up to $35,000 for up to 5 years. If when you finish your PhD you get a full-time teaching job, in 4 years' time you can erase 85% of the balance and pay the rest over 10 years at a 3% interest rate. It's a very good deal. We also recently have been able to offer fellowships. We have a Dean's Office Fellowship. We have several Robert Wood Johnson Future of Nursing Scholars Fellowships, and we have a few Villanova University Fellowships. So if you are a local full-time student, we encourage you to express interest in these fellowship opportunities. We've had a number of students also supported by the Jonas Center for between $6,000 and $10,000 per year. And so other students have brought in money from other organizations, the National League for Nursing, the American Cancer Society. So there are a number of opportunities out there. Students have an opportunity to study either part-time or full-time. Full-time study should result in completion of coursework in 25 months. Part-time study, as dictated by the curriculum plan on the website, should result in completion of coursework in 37 months. And then after that is the dissertation phase of the program. I have a few questions that have been submitted, and one goes back to this question of length of the program. So how long is the program? So if you're a full-time student, you should be able to finish the program in 3 to 4 years. I have had at least one student finish in 3 years, a little less than 3 years actually. She finished coursework in 27 months. She defended her proposal in August after finishing coursework, and really was able to gather data, analyze it, and write her dissertation for defense in April of that 3rd year. A part-time student should be able to finish the program in 4 to 5 years. We allow students to have up to 8 years, but really most people want to get out of here before then. We've talked about how to get the dissertation committee, but again, that's a common question, so it doesn't have to be your academic advisor that you're assigned who's going to be your chair. Over the course of your studies in the first year and into the second year, you'll meet lots of faculty and you'll figure out who you mesh with really nicely, and that person will help you figure out who's going to be the second committee member. And then a question that I think every single applicant has asked is, do I really have to take the GREs? And the answer is yes. We've never let anybody have a waiver. I will take GRE scores that are older than 5 years. The Educational Testing Service does not maintain them past 5 years. That's why we have a 5-year limit. But if you have an official copy of your GREs that are older than 5 years, I will take them, and I don't care how old they are. But the university really does like us to have that information on file. I want to again refer students to the website that gives very comprehensive information about the program, application process, prerequisites. There's really only one prerequisite, and that's that you have had a college math course ever. That's from our statistics professor. I have a wonderful program assistant who will be happy to help you through the application process and answer questions, as will I. We invite emails and calls, and our contact information is available for you on the website. I want to thank you so much for your interest and your participation in the webinar. And Stephanie, thank you for joining me.
Thank you.
Okay.